This is our trip to France. First, we flew from Reno to San Francisco, and this is what we saw. Then, we flew from Reno all the way over to England, and this is what greeted us. Next, we flew from England down to Madrid, and this is what we saw in Spain. From Spain, we flew over to Paris, and this is what we expected to see. Little did we know what France really had to offer.
According to the World Health Organization, depression is a common mental disorder. Globally, more than 350 million people of all ages suffer from depression. Depression is the leading cause of disability worldwide and is a major contributor to the global burden of disease. At its worst, depression can lead to suicide. WHO's World Mental Health Survey initiative showed the two most depressed countries are France with a 21% prevalence and the United States with a 19% prevalence. There are effective treatments for depression.
Before our travels to France, we educated ourselves about the demographics by looking at the World Health Organization and compared it to the United States. As you can see, the gross national income per capita is about $7,000 less than that of the United States. The life expectancy for a male at birth is in the high 70s, and for females, it is in the mid to low 80s. The amount of money spent on health in France is half of what the United States spends on their health. There is a 0.4% difference in unemployment between the two countries. France has a higher percentage of the population with access to improved drinking water. The number of nursing and midwifery personnel in the United States exceeds France by more than 2,650,000. The infant mortality is 3 times higher in the United States. Both countries had the same number of TB incidents per 100,000 people and the same number of birth rates per 1,000 people. The prevalence of HIV is 0.3% higher than that of France.
Among our travels, we have discovered significant variances within the French culture in regards to depression. With the prevalence of depression in France being as high as 21%, many studies have been performed to find possible reasons. The characteristic associated with a higher risk of depression were not being in a managerial professional position, having a low educational level, being single, as well as being of foreign nationality and female gender. The prevalence of depression is estimated to be as high as 41% among the least well-off women in France, portraying a large disparity within the different socioeconomic classes. France also has a significantly high amount of immigrants, and there are many struggles they encounter every day. Even though France offers direct, unrestricted access to specialized health care, which results in a relatively high amount of practicing psychiatrists compared with other countries, 23 per 100,000 inhabitants, the possibility of most immigrants not having the standard health insurance may be significant in their lack of health care seeking behavior. Being of French nationality and having health insurance coverage were associated with individuals with more frequent healthcare visits. Especially in urban regions of France with extensive medical resources, psychologists are playing a growing role in the management of depression.
Cigarette smoking in most venues was largely accepted by the French culture until 2007. It was then that the country's legislature forbid people from this act and enclosed public places due to the alarming rate of deaths attributed to first and secondhand smoke. What we were able to observe in our time in France was that while the laws lessened the opportunity, the desire to smoke by the French people had not decreased, with an estimate of 1/3 of the population having this addiction. The relationship between cigarette smoking and depression has been firmly established. Research has shown that the chemical nicotine in cigarettes ultimately changes the brain's plasticity and can cause a depressed mood when the smoker is not getting their usual daily dose of this chemical.
Primary prevention for depression, such as public education, developing adequate coping mechanisms, knowing triggers and avoiding them will help prevent one from becoming depressed. Beginning in 1992, the World Federation of Mental Health began the celebration of World Mental Health Day. Every year on the 10th of October, with more than 150 countries participating, supporters join in celebrating World Mental Health Day. The World Health Organization is one of the powers supporting the development of mental health education, awareness, and advocating for those with mental illness. The theme of World Mental Health Day in 2013 was mental health and older adults. Negative perspectives and modes of thinking have been shown to be predictors of depression. These negative mental scripts increase the risk of people having recurrent episodes of depression. The Scrambled Sentences Test, SST, allows an individual to reword scrambled phrases. According to Dr. Stephanie Rood in Unscrambling Depression, how the word is rephrased can predict an occurrence of major depressive disorder months or even years later. The use of such tools, such as unscrambling words before depression has occurred, demonstrates the importance of picking up cues that may lead an individual to depression or allow a nurse to discover when a patient is depressed.
Depression screening and annual wellness visits are secondary prevention measures. In a French study done in 2010, only half of depressed patients reported having discussed depression with their physician. And of those surveyed, more than half reported having a regular physician with an already established relationship. Immigrants were less likely to bring up the subject of depression with their provider. 80% of those surveyed reported they would have liked to have been asked about their mental state more often. During assessment, it is important for healthcare professionals to allow the patient with depression adequate response time. Pay special attention to providing culturally competent care during assessment. Patients should also be screened for other contributing factors such as underlying diseases and substance abuse. During assessment, patients should be screened for cognitive and comprehension difficulties, which can be indicators of depression.
For non-pharmacological tertiary interventions, it would be most influential to counsel patients to seek group therapy or any other positive support system. Other helpful interventions include relaxation techniques, music therapy, imagery, therapeutic touch, and pet therapy. A healthy sleep schedule can also aid in minimizing feelings of depression. Above all else, ensure the patient is safe from self-harm. Pharmacological treatment is another option in the treatment of depression. These medications include SSRIs, such as Prozac, SNRIs, such as Effexor, atypical antidepressants, such as Wellbutrin, MAOIs, such as Nardil, and tricyclic antidepressants, such as Elavil. It is very important to educate the patient on potential side effects of these medications, including weight gain, sexual dysfunction, urinary retention, and orthostatic hypotension. Explain the importance of adhering to the medication regimen and dosing schedule. Sudden discontinuation of antidepressant medications can cause serious side effects. Using pharmacological interventions along with non-pharmacological interventions can assist the patient in finding the best method to cope with depressive symptoms.
When we were getting ready to leave France, we realized that, while it was not the happiest trip, we had a lot of information to take home with us. France may be number 1 in world rankings with depression, but the US is ranked number 2. It is our duty as nurses to get involved in the fight against depression because it is the leading cause of disability worldwide. Become active with your local, national, or worldwide organizations. Thank you for your time and listening, because we know listening means caring.